I am here presenting the Trivandrum atrial fibrillation study. As you all know, atrial fibrillation is the most prevalent, sustained, and serious heart rhythm abnormality worldwide. The prevalence is predicted to increase in the near future with population aging and increasing prevalence of risk factors. Early detection and proper management are crucial. However, AF often goes undiagnosed and suboptimally treated, especially in rural resource countries like India. Lack of data regarding the exact burden of disease, especially at the community level, is the main factor which precludes early detection and implementation of adequate control measures. So we conducted this study to describe the prevalence of AF in Trivandrum district, to characterize the clinical profile of AF patients, and to study the appropriateness of treatment of non-AF patients. This was a community-based cross-section study from September 2019 to June 2022. We recruited samples from urban and rural wards of Trivandrum district using multi-stage cluster sampling with probability proportional to the size of the population. And we included all individuals greater than 18 years of age who are giving consent. We calculated the sample size based on this study, which was published in Circulation in 2014, the World Epidemiology of Atrial Fibrillation by Chu et al. Based on this study, the proposed prevalence in India was 0.4 to 0.47%, and based on this, our sample size was calculated to be 63,643. So we rounded it to 65,000, but due to the ongoing COVID-19 pandemic, we had to reduce our sample size. We collected data using a single lead ECG device, which is the Alive Core Cardia single lead ECG device, which is an FDA approved device. It has got 2 electrodes. On placing both fingers of both hands on it, it will generate a 30 seconds single lead ECG, the bipolar lead one. And at the end of 30 seconds, it will show an automated results, and also it will generate a 30 seconds single lead ECG PDF, which can be shared online. So we collected the basic data of the patient using Google Forms. Initially, we conducted one pilot study in September 2019 using 1 ward and 1 ASHA worker. We screened 500 participants, and we learned some lessons, and accordingly we modified our methodology, and we proceeded to study proper. The first step, we trained ASHA workers for providing health education, for obtaining informed consent for screening the participants. As step 2, these ASHA workers did the community screening using the single lead ECG as well as the Google Forms. And we physicians, as step 3, reviewed these responses online, and we made list of confirmed AF cases, cases who are doubtful AF cases, and patients who are having symptoms of AF but normal ECG. And all these patients were called for the community medical camp, where we did the detailed examination, total lead ECG, and transthoracic echo. So till now, we conducted 71 training sessions. We approached and screened 51,126 participants. We conducted 84 community screening camps. And in each camp, we examined around 60 to 80 patients. Coming to the results, the total number of participants were 51,126. The minimum age was 18, the maximum age was 103, the mean age was 47.78. The urban and rural areas were almost equally distributed. Also, male and female gender were almost equal, as in the case of normal population of the Trivandrum district. And we got 470 out of 51,000 cases of 470 cases out of 51,000 population. So the prevalence was calculated to be 0.92%. With 95% confidence interval, the prevalence ranged from 0.84 to 1.01. And the prevalence in more than 40 age group was estimated to be 1.48%. Out of these, the majority were new onset AF, newly diagnosed AF. They were 58.1%. And the predominant category was persistent AF, 58.8%. And malleable AF was only 6.3%. And coming to the age group-wise prevalence of atrial fibrillation, there was clear increase in the prevalence of atrial fibrillation with age. We can see the prevalence has increased from 0.41% in 40 to 49 age group to more than 11% in more than 90 years of age group. Also, the mean age of the AF population was 64.5, which was more than around 20 years higher than the mean age of the normal population. Coming to the area-wise prevalence of atrial fibrillation was significantly high in patients living in urban areas when compared to rural areas. Also, it was significantly high in patients, in male patients compared to females. Coming to the symptom profile of AF patients, palpitation was the predominant symptom. It was there in 73% of the patients, followed by dyspnea, fatigue, dizziness, chest pain, syncope, and stroke. And 18% of the patients were not having any symptoms. Coming to prevalence of risk factors, hypertension was the predominant risk factor, followed by diabetes, dyslipidemia, and coronary artery disease. And all these risk factors were significantly high in patients with AF compared to other patients. And other risk factors like smoking, alcoholism, thyroid disease, obesity, and obstructive sleep apnea syndrome all were significantly high in patients with atrial fibrillation. Coming to the relative prevalence of complications, heart failure was the predominant complication in patients with atrial fibrillation. It accounted for around 22% of patients with atrial fibrillation, followed by stroke, dementia, and depression. And all these risk factors were significantly high in patients with atrial fibrillation when compared to those without. Coming to the appropriateness of treatment of non-AF patients, we had around 196 patients who were non-AF, and out of these, around 87% of patients were requiring anticoagulation, and among them, only 58.2% were on oral anticoagulation, and 41% were not on. And among patients who were on oral anticoagulation, 81% of the patients were on vitamin antagonists, and thus 18% was on NOAC. And among patients who were on vitamin antagonists, only 15% of the patients were having their INR within therapeutic range. To summarize, AF is prevalent in almost 1 in 100 adult individuals in Trivandrum, Kerala, which is more than double of what has come in literature so far. The prevalence of AF is higher in males, urban areas, and it increases with age. So AF is clearly more prevalent in our population. The mean age of population, AF population in our study was 65. The estimated prevalence in West is 69. So our population of AF patients are younger. And in our population, the more than half of the cases were previously undiagnosed. The estimated prevalence of undiagnosed AF in the US is only 14%. So our cases are more undiagnosed. Heart failure was the predominant complication, followed by stroke, dementia, and depression. And majority of the patients, our patients were undertreated with poor symptom control. And INR was in therapeutic range only in 1 out of 6 AF cases. So, going with the theme of our CSA 2022, look ahead and dream big. So, we were dreaming big, and this is the result. This is the first large community AF screening study in the world, and first large systematic AF screening study in the world. This is the first AF screening study targeting whole adult population in the world, and first Indian community AF screening study done with the help of ASHA workers and done using single lead ECG device. Thank you.